Hello, good evening. I am Mamudu Gajaga and this is QTV News coming to you live from our studios along Kairaba Avenue. Thank you for joining us. First, here are the main local and international news headlines. The MRC unit at the London School of Hygiene and Tropical Medicine in the Gambia today inaugurated a new high-tech molecular biology lab. The Edward Francis Small Teaching Hospital today received donated medical items worth over $15 million. The Ministry of Basic and Secondary Education and partners have organized training for journalists on reproductive and sexual health education to promote discussion and reporting of the subject in the media. In international news, Equatorial Guinea, whose president has been in office for 41 years, today celebrates 53 years of independence from Spain. Those were the main news headlines, and now the news in detail. Welcome and thank you for joining us. This is QTV News. The MRC unit at the London School of Hygiene and Tropical Medicine in the Gambia today inaugurated a new high-tech molecular biology lab that will boost the unit's capacity to quickly track and respond to any potential emerging health threats in the sub-region. Murulamin Choi has the details.
MRC unit, the Gambia, among the leading health research outfits in West Africa, is inaugurating a molecular biology laboratory. The lab has the capacity to strengthen and boost the unit's volume of research for quick response to potential emerging health threats facing the world, and sub-Saharan Africa in particular. This important inauguration was attended by the Director of London's School of Hygiene and Tropical Medicine, the MRC Gambia Unit Director, and presided over by the Vice President. The Unit Director of MRC Gambia, Professor Umberto D'Alessandro, expresses MRC's commitment to responding to research and emerging health threats facing the world and recognizes the opportunities offered by technological innovation in addressing health problems.
We will continue to investigate and evaluate new interventions, new approaches to provide evidence supporting health policies that will make this world a fairer place where everybody will have the same opportunities to develop his or her own potential.
The London School of Health and Tropical Medicine's Director, Professor Liam Smith, highlights the existing and emerging health threats facing the world and the demanding task to improve health infrastructures through research that underpins vital response policies.
It's fantastic to see this building come to fruition. It really will have an incredibly long shelf life. It's future-proofed. It's just going to provide the best facilities needed, and it really is a hugely welcome step.
On behalf of the Minister of Health, Dr. Mustafa Bite, the Director of Health Services, acknowledges MRC's support to Gambia's health sector through capacity building of health workers, research interventions, medical services, upgrading of the National Public Health Laboratory, and COVID-19 response.
We look forward to strengthening this relationship. We hope that this edifice will enhance the capacities of MRCG and also raise what can be done in the Gambia to better answer our health policy needs and strategies.
The Vice President of the Gambia, Dr. Aïssatou Touré, delivers remarks on behalf of President Barrow. The VP expresses gratitude to MRC's partnership with government, its contributions to support the health sector, and gave reassurance of government's commitment to maintaining an enabling environment to nurture and create the desired health expertise for more developments in line with the NDP and the global SDGs.
The inauguration of this new laboratory building will enhance these contributions and support our work as a government. I am convinced that this new facility will further strengthen your research and diagnostics capacity and complement our work, particularly under the Ministry of Health.
The molecular biology lab was funded by the UK Research Institute at an estimated $200 million plus. The building has an office space that can host 280 staff, a laboratory capacity that can accommodate up to 100 lab technicians, equipped with smart technology for high volume of sample testing and tracking of disease outbreaks for quick response.
It will be difficult to find an equivalent building in terms of it being a smart build the environment being under control, and the sheer footprint we have here. It's about 800 square meters of laboratory space for molecular biology work.
The MRC Unit of Gambia at the London School of Health and Tropical Medicine is one of 2 research units established in sub-Saharan Africa by the Medical Research Council UK, which is its single largest investment in medical research in a low and middle income country. Mohamed Lamin Choi, QTV News.
Congratulations to the MRC, massive boost for the health sector. A donation of $15 million worth of medical equipment was made on Tuesday to the Edward Francis Small Teaching Hospital by Human Appeal Ireland through their representative in the Gambia. Loli M. Camara has the details.
To provide immediate relief and support to people with urgent needs, Human Appeal donated medical items to boost the needs of this hospital. The items donated include hospital beds, wheelchairs, crutches, monitors, ultrasound machines, and surgical materials, amongst others. At the event, the Chief Medical Director at Edward Francis Small Teaching Hospital, Professor Usman Nyan, thanked the donors for a timely and much-needed donation.
We currently have a team of about 12 practitioners from Spain. They arrived yesterday and they are here just for a week. So when they saw one of the towers, they wanted to move it straight, and we said, well, let them wait till after the presentation. Because with that equipment, they can do more. They are here just for a week, but this would add value to what they came to do. Just as an example, that we do have medical teams come and go, do various things, but some of it is limited by what equipment we have on the ground.
On behalf of his minister, Muhammadu Lamin Jaite, the permanent secretary at the Ministry of Health, expressed appreciation to Human Appeal Ireland for their intervention to supporting the health ministry.
We promise that every item here will be put to very good use, will be at the service of the patients, and we will take good account of them anytime you refer to us, and we can be able to produce a report of what they have been able to help us achieve.
Imam Ibundur, head of Human Appeal Ireland, said he felt the need to give back to the hospital that continue to provide people of this country with healthcare needs and urge people in the diaspora to emulate this.
But I urge the authorities to do more and invest in machines and equipment and training for the staff. I also appeal to Gambians and friends of the Gambia to all join hands and help to bail out the healthcare system. We try to inspire other people as we were inspired by others. We should take a holistic approach. This equipment, machines and medical supply has been sourced with great logistic challenges and shipped to the Gambia. We are entrusted by the donors and the Board of Management of Human Appeal Ireland to deliver it, and I appeal to the authorities and management of the hospital to take inventory of all these supplies and use it for the patients.
Human Appeal is a non-profit organization working across the globe to strengthen humanity's fight against poverty, social injustice, and natural disasters. Since its establishment in 2016, it has supported the Gambia with relief services worth millions of dollars. For QTV News, Loli M. Kamara.
The Ministry of Basic and Secondary Education, in partnership with the International Development Research Center, is organizing a training for journalists on reproductive and sexual health education to promote discussion and reporting of the subject in the media. Mohamed Lamin Choi reports.
Teaching our children reproductive and sexual health faces obstacles both at home and in school, leading to inadequate quality of knowledge on the subject and grave consequences among adolescents. To address this, the Ministry of Basic and Secondary Education, in partnership with the International Development Research Center, Canada, are seeking to improve access to quality health education in schools and communities through a research project. Fabian Aina Grant Sanya, the Principal Research Investigator of Comprehensive Health Education Project, tells us about some of the research findings which highlight cultural factors leading to limited communication between parents and children on reproductive and sexual education.
And the other aspect, the findings told us that because of the culture, that's why adolescents are not able to communicate with their parents. Likewise, the other way. Also, shame and shyness and lack of knowledge from the parents as well. That's why they don't communicate with it. We have found also that the STD rate is high, but adolescents also utilize the contraceptive, that is the condom. They use the condom, as been found in the research that they use condom just not to impregnate each other, because pregnancy outside wedlock is an abomination.
As part of embedding the research and raising awareness of reproductive and sexual health education, 25 journalists from the print and electronic media are being trained as a medium for generating discussions and reporting key issues of concern on comprehensive health education. Here is Dr. Musa Marena, who is the program manager of the Reproductive, Maternal, Medical and Child Health Unit at the Ministry of Health.
Reproductive health is not different from any other thing. So if our people don't even understand how reproduction begins, when they start producing, then you will see the effect. So these are some of the reasons why we are having this maternal mortality that everybody is talking about. Women, if you go to the hospitals now, you see a lot of women with complications in related to sexual and reproductive health. You have a lot of teenage pregnancies and so many issues surrounding reproductive health issues.
The introduction of sexual and reproductive health education in the Gambia dates back from the early 1990s, when the country had been using the school curriculum to deal with high population growth rate, adolescent pregnancies, illegal abortions, and drug abuse, among others. This comprehensive education research was conducted on in and out of school students in Region 1. The Curriculum Research, Evaluation and Development Directorate of MOPSI has been working towards addressing the challenges facing comprehensive health education by revising the education curriculum and integrating it into career subjects to strengthen quality access on the subject.
After the integration also we develop manuals. After the manuals also we have trained teachers. As I am talking to you now, we train 160 teachers in Region 1 and 2, and we have 100 teachers more to train in Region 4, 5 and 6.
Objectives of this pilot project include using the research findings to inform the design and implementation for school and community-based programs on comprehensive health education, targeting both in and out of school adolescents in Western Region 1, and the design and implementation of a range of interventions for policymakers. Mahmoud Lamin Choi, QTV News.
That report by Mahmoud Lamin Choi will take us to a short commercial break, and when we return we'll have still some more local and international news stories for you. Do stay tuned.
The best product in town is back. QCell's MiFi router. Get the best MiFi in the country for just $2,800 and connect up to 15 users with 4G internet speeds and a long-lasting battery life. So rush now to any of our customer care locations and get the best for less while stocks last. For more info, call our customer care on 111. QCell, Senior Boss, the Gambia's quality network. We innovate, others follow.
Q Money, the biggest mobile money service in the Gambia, has taken mobile banking to the next level. Now, you can link your Q Money wallet with your bank account. Yes, link your Ajib or EcoBank accounts with your Q Money wallet and get instant access to your cash anytime. No need to queue at the bank anymore. Transfer funds from your bank account to your wallet or your wallet to your bank account using Q Money Bank Link is the fastest, most secure and convenient way to transfer funds between your wallet and bank account. For more information, call our customer care on 133. Q Money, Sunyu Kalpe. Terms and conditions apply.
Welcome back, and thank you very much if you're just joining us. This is QTV News. The Gambia YMCA and partners on Monday organized a conference that brought together stakeholders from different sectors advocating peaceful elections as the country approached an electoral cycle. Babukar has the rest of that story.
The gathering brought together youth representatives from all the political parties, CSOs and journalists under the theme Peaceful Elections for a Peaceful Gambia. The organizers are seeking to encourage the media, political parties and CSOs play their part in ensuring that from now on, the interests of the Gambia will be at the forefront ahead of any other interests, particularly as we approach an important electoral cycle. Priscilla H.D. Don, Program Director of YMCA, the Gambia, said this year's conference centers on young people and peace.
The Gambia Bureau of Statistics have determined that over 60% of the Gambian populace are youth. What does this mean to us? This means that we are a very relevant group in the Gambia and that we hold the potential for change. But then, how do we use this power? Together, we share in plans to improve our education, to obtain skills, to secure well-paid jobs, to take care of our families. These objectives cannot be achieved if we continue to allow ourselves to be agents of destruction and precipitants of conflict.
Francis D. Mendy of Caritas Gambia said the 2016 elections taught us a lot as Gambians. Thus, we all have a role to play as we head to the 2021 elections.
We have already done the voter registration. And during the voter registration, there was a lot of noise. And some of us may have unknowingly taken part in peddling these stereotypes as to who is a Gambian and who is not a Gambian. I always say this, we don't need to look far. What happened in La Côte d'Ivoire was not started by the military. It was started by the elites who wanted to keep power. And so they brought about this concept of ivoirité. Maybe in the Gambia, I will say Gambianness. But all of us around this house this morning, is there anybody here who cannot trace his family to another country in the sub-region?
For John Charles Njai of the YMCA, Work for Peace seeks to create opportunities for young people to strive and give them opportunities to become better citizens.
When we talk about Work for Peace, we are talking about creating opportunities that will go well for a peaceful coexistence. Any young person that is deprived of opportunity, that young person is an asset in the hands of evil to destabilize, to disrupt, and to become a potential criminal. Your destiny is in your hands. If this country goes through a peaceful elections, it will be you young people. If it does not, it will be you, the young people. The ball is in your court.
This is yet another platform created by YMCA, who join other institutions in advocating for peace and tolerance ahead of the country's election cycle. Babu Karsi, QTV News.
Binti Period, a charitable organization that focuses on creating awareness on menstruation and helping women and girls understand their menstrual cycles, launched its menstrual education program on Monday, which will be implemented in schools across the country. Ansumane Sonyasi reports.
Of this program ushers in a new phase in the charity's advocacy work, as this is the first time it has embarked on such a project in the Gambia. With plans to have the subject integrated into the school curriculums, the Binti Period menstrual education program has been hailed by government officials, parliamentarians, parents and teachers as the missing link between effective advocacy and attitudinal change in dealing with taboos and stigma around menstrual periods. At the event, Manjit Kejil, the founder, says she was inspired to set up Binti Period, having learned about the struggle women and girls in Kenya and the UK endure during their menstrual periods due to the lack of access to menstrual period products.
From some telling me that they had to sell themselves, others using cow dung, animal skin, leaves, whilst some would sit on a hole for a week. Now the consequence of that is that girls will drop out of school, they will get married quite young, have babies, and that cycle of poverty persists.
Highlighting the importance of advocacy and awareness creation, Lamia Sur, founder of LS Consulting, one of Manjit's main partners, and David Belgrove, British High Commissioner to the Gambia, called for concerted efforts to ensure easy access to menstrual period products and facilities such as clean water to help girls stay in school during their menstrual periods.
I believe it is fundamental and essential for any society to look after, support, and empower its girls and women. The menstrual and puberty education that Binti will roll out across all 6 regions in the Gambia will help immensely in empowering our girls and educating them further.
Just to say that we're fully behind this initiative. I wish Manjeet and Lamir and everybody involved in this initiative all the best. And the real work, I know, will not be in this room, but it will be out in the schools, out in the field, where this really counts and where what they're doing really counts. And I look forward to working with Binti in the future and throughout.
Several other speakers at the event also stressed the need to intensify the campaign to promote and facilitate easy access to sanitary pads in schools and homes. They also called on men to support the program and further emphasized the importance of having the conversation on menstrual periods. Monday's event was attended by several National Assembly members and senior government officials. It also featured performances by students of Latrikunda Primary School and a dance group. Binti was the first period charity registered in the UK and India, with a mission to provide menstrual dignity to all girls all over the world, and the charity is engaged in facilitating access to pads to ensure menstrual health, educating girls about what menstruation is and what they can expect from it, and dispelling stigma, taboos, myths, and negative perceptions around menstruation. Ansumane Sonyasi for KTV News.
And that report by Ansumane Sonyasi will take us to international news. October 12th marks the 53rd anniversary of Equatorial Guinea gaining independence from Spain in 1968. We looked at the country's unique history. More in this report.
Equatorial Guinea, also known as AQG, is the only African country with Spanish as an official language. The country has 3 European languages as official languages, and other 2 being French and Portuguese. The Central African country, with a population of 1.4 million, was a Spanish colony from the 1700s until gaining her independence in 1968. Despite its small size, it has been the 3rd largest oil-producing country in sub-Saharan Africa since in the mid-90s. However, many in the country have not benefited from this, as the oil-rich Central African country has had a history of corruption, dictatorship and poverty. Almost since independence, especially under the regimes of Francisco Messias Ngoma and Teodoro Obiang Ngoma. Francisco Messias Ngoma was the first president after the country gained independence and remained so until his overthrow in 1979 by his relative, the current president. Francisco was infamously named as one of the most brutal dictators in history. Teodoro Obiang deposed his uncle on 3rd August 1979 in a bloody coup d'etat. Over 2 weeks of civil war ensued until Messias Ngoma was captured, tried and executed soon afterwards. Francisco's successor, Teodoro Obiang Ngoma, holds the record as the longest-serving president for 41 years. Both Teodoro and his son, who is one of the country's 2 vice presidents, have been labeled corrupt and his father brutal. Equatorial Guinea's government is authoritarian and has one of the worst human rights records in the world, consistently ranking among the worst of the worst according to the Freedom House annual survey of political and civil rights. Reporters Without Borders ranks President Obiang as predator of press freedom. His son Teodoro Ngoma, who lives an overly luxurious lifestyle, has recently been sanctioned in the UK and faces criminal conviction in France after being exposed as embezzlement. Ironically, with all the oil riches and wealth, the distribution of wealth is uneven, with few people in the country are benefiting from it. The country ranks 144th on the 2019 Human Development Index, with less than half the population having access to clean drinking water and around 1 in 12 children dying before the age of 5. About 3/4 of the population lives below the poverty line. Equatorial Guinea is currently home to the Gambia's ex-president Jammeh after he went into exile in 2017. Aside from the country's bad reputation, this small gem of Central Africa has beautiful nature landscapes such as the Corisco Island, crystal white sandy beaches, waterfalls and national parks, attracting tourists from around the world. It has the highest literacy rate in Africa, with 95.3% being able to read and write. In terms of religion, the people are predominantly Roman Catholic, Muslim, Baha'i, Animist, indigenous faith. Equatorial Guinea is one of the smallest countries in Africa, consisting of a mainland territory and 5 inhabited islands. The capital of Malabo is located on the island of Bioko, approximately 25 kilometers from the Cameroonian coastline in the Gulf of Guinea. The people consist of various ethnicities, including the Fernandino people, Creole people who are descendants of enslaved Africans, Portuguese, Yoruba, Seke, Igbo, and more. Despite all their troubles on this day, we wish them a happy 53rd Independence Anniversary. Ajibintu Drame, QTV News.
Well, that's it for QTV News tonight. Thank you for joining us, but don't forget to connect back to us again at 10 p.m. for another news bulletin.